Hello, my name is Shayan Siddiqui. I'm a grade 12 student at Weber Academy, and this is my project, The Effect of Mutations to Genes Associated with the Development of Pediatric Autoimmune Diseases on Patient Prognosis in Non-Hodgkin's Lymphoma. Before I begin, I'd like to thank Dr. Arun Narendran, Nadia Narendran, and Andy Tran, all at the University of Calgary's Arnie Charbonneau Cancer Institute, for their invaluable help and guidance on this project. So some background. Autoimmune diseases are a category of diseases that affect over 10% of the global population. Within Canada, the incidence rate of autoimmune diseases are increasing, with current statistics suggesting an annual increase of 7.5%. This is quite concerning as autoimmune diseases affect both children and adults. There are both environmental and genetic factors at play. So autoimmune diseases also are associated with the development of non-Hodgkin's lymphoma, a type of cancer. Patients with rheumatoid arthritis, systemic lupus erythematosus, celiac disease, Hashimoto's thyroiditis, and Sjogren's disease have up to a 25-fold increased chance of developing a non-Hodgkin's lymphoma. Current research has been inconclusive about the specific genetic link between non-Hodgkin's lymphoma and autoimmune diseases, and furthermore, no studies focused on pediatric autoimmune diseases and the development of cancer later on in adulthood have been published. So for this study, we focused on the 6 most common autoimmune diseases within the pediatric population: systemic lupus erythematosus, systemic scleroderma, Sjogren's, celiac disease, Behçet's disease, and ankylosing spondylitis. So the research goal for this project. This study aims to look into the effect of mutations on genes that are associated with the development of pediatric autoimmune diseases on patient prognosis for non-Hodgkin's lymphoma. So the methods, how did we do this? So first we acquired the genes associated with the development of pediatric autoimmune diseases using the DAD database. So this text mines the entire PubMed database to look at papers that suggest a link between a specific gene and an autoimmune diseases. Then we took genes associated with 3 or more diseases. From there, we took these genes and inputted them into CBioPortal, where we accessed 16 non-Hodgkin's lymphoma studies with a total sample size of 3,727 samples. We found the most common mutations to genes from DAD, and then we explored if it was present in more than 0.5% of the total sample size due to statistical limitations. From there, relevant patient information was recorded, such as their survival status, survival in months, what mutation they had in their patient ID, all into Excel. And then we also inputted the patient survival status and survival in months into GraphPad Prism 8 to make Kaplan-Meier survival curves and to calculate significance and for statistical analysis. So some results and discussion. So in terms of our significance, we ran 2 different tests: the Mantel-Cox test and the Dehan-Breslow-Wilcoxon test. And I'll get into why they differ a bit. So one group of mutations we had were to the gene BCL2, and they were the mutations A6CV, G8R, S96 splice, and G8E, where they were significant. So we all see that they have less than ideal patient outcome when compared to the wild type, especially this one over here, G8E, where the p-value was under 0.0001. So, and actually if we look at A6CV over here, we see that one of the p-values was greater than 0.05, which is what p is usually set to determine significance. However, the other one was under. This is due to that there's a lot of early deaths, but it stabilizes later on. So this second test, that Dehan-Breslow-Wilcoxon test, places a greater emphasis on earlier deaths, and that's why it is significant. So overexpression, and a reason for all of this is that the overexpression of BCL2 proteins in non-Hodgkin's lymphoma has been associated with a poor prognosis for mutations, so these mutations could possibly promote this function. Then we had another mutation to BCL2, which is T56M, which is again significant. We see that it has a lower patient outcome. So T56M residue is phosphorylated in BCL2. The effects of this modification are unknown, but it's suggested that it provides a binding site for anti-apoptosis proteins, which effectively delays cell death. The inhibition of cell death by BCL2 has been associated with tumorigenesis within cancer patients, which should explain for the poor patient survival. Then we had the most important and most interesting mutation in the entire study that I found, at least, which is the Y640F mutation to STAT3, where we actually see that all the patients with this mutation survived for over 350 months when compared to the wild type, and the p-value is 0.04. So the reason for this is actually STAT3 is overexpressed in non-Hodgkin's lymphoma, which has been observed to result in poor patient outcomes. However, the Y640F mutation that causes a change in the protein's interaction with the TYK2 enzyme, which actually results in the underexpression of STAT3. So this could result in the increased survival rate observed in our study. And then we have another group, which are the non-significant BCL2 mutations. So the mutations H120Y, L86F, G33R, P59S, H22, and R129H, on average, they displayed survival rates similar to the wild type. So they've actually been observed to not significantly change patient outcomes in follicular lymphoma, which is a type of non-Hodgkin's lymphoma, within a given specific treatment course. So there are some data to back up this non-significance. Then we have another one, which is X195 splice. More research is needed to carry out on the role of BCL2 X195 splice because there's not enough information out there to actually determine why it is not significant. It would suggest that it does not cause a higher expression of BCL2 proteins, or it doesn't provide a binding site for anti-apoptosis proteins. And then we had the gene TP53, where all of its mutations were non-significant. So it's actually been observed that TP53 mutations are prognosis indicators for non-Hodgkin's lymphoma. However, there's not enough information on the mutations for more decisive analysis. So we see on average, again, we have these curves that are similar to the overall wild type curve, and the p-values also demonstrate their non-significance. Then we have to the gene FAS, and more specifically the mutation V220GFS *6. So it's been suggested the downregulation of FASR, which is the protein produced by FAS, on B cells can help B cell lymphoma go undetected, which worsens patient prognosis. B cell lymphomas are a type of non-Hodgkin's lymphomas. This would suggest that this mutation does not induce the underexpression of FASR. Then we had the mutations to the SOCS1 gene. So we see again they're on average similar survival rate. So deletion mutations in SOCS1 have been associated with a high patient survival. However, S116N, S125Y, and A16T are missense mutations which could indicate they have average outcomes. However, more information is needed and more research is needed to explain the roles. And then we had the mutation E17K to the gene ETS1, which again is not significant and displays a similar rate to the control group. It's been observed that high expressions of ETS1 worsens patient prognosis in non-Hodgkin's lymphoma, which would suggest E17K does not cause ETS1 to be overexpressed. So how can this data be used? These findings can be used as a purely prognostic information for people who develop non-Hodgkin's lymphoma. In conjunction with the genetic profile of a patient, doctors will be able to give patients a more accurate prognosis in terms of how long, if they have to live, and suggest treatment courses based on their average time left to live. So what is inclusion? In conclusion, there's three distinct groups of mutations. Those that improved patient prognosis, those which decreased patient prognosis, and those that didn't really affect patient prognosis. So patients with pediatric autoimmune diseases would be more likely to have mutations to the genes explored in this study, as mutations to the genes, and these genes themselves are also associated with the development of pediatric autoimmune diseases. Depending on the mutation of the patient, this would mean that if they develop non-Hodgkin's lymphoma, they're at a risk of a poor prognosis, because we saw the majority of the mutations that we had that were significant did cause a decrease in patient outcome. Thank you for your time.